Okay, our group had the developmental stage school age 6 to 12 years. Physical characteristics. Physical development is slow but steady during this stage. Muscle coordination is well developed and children can engage in physical activity that require complex motor sensory coordination. Boys and girls. Fat gives way to muscle and the child may appear leaner. Jaw proportions change as permanent teeth start to erupt. Body organs and the immune system begin to mature. The urinary system can adjust to changes in fluid status. Physical skills are refined through fine motor skills, and leg length begins to increase. Boys will start to grow underarm, chest, and pubic hair. Their testicles and penis will grow as well. Boys usually start puberty around the age of 11, and they can have growth spurts between 1 to 2 inches a year. Girls will begin to develop breast tissue. They'll have underarm and pubic hair growth. Their menstrual cycle will likely develop, and they can experience growth spurts from 4 to 5 inches a year. Mental development develops quickly, and much of the child's life centers around school. Reading and writing skills are learned, and they are able to understand abstract concepts like honesty, loyalty, values, and morals. They're in the industry versus inferiority conflict stage. In middle childhood, they begin to see things from other school-age children's perspectives and can understand how their behavior affects others. They are developing their oral language skills, acquiring new vocabulary and sentence structures. They can understand concepts of space, time, and dimension. They know their left from right. They begin to develop a sense of self-confidence and mastery of their learning. They're learning to read and write, and they can reason and argue. They are able to perform simple addition and subtraction. In early adolescence, ages 8 through 12, most adolescents are fully capable of perspective talking and understand and consider others' perspectives. They can think hypothetically, consider a number of possibilities, and can think logically. They become more goal-oriented. They may develop special interests and motivation. Cognitive development may be impacted by school-age children's emotional state. They begin to understand facets of the adult world like money and telling time. They can interpret the context of paragraph and write stories, and they appreciate humor and word games. Next, we have psychosocial development, broken down into 3: play, personality and temperament, and sexuality. Play is enhanced by increasing fine and gross motor skills. They can understand that everyone has a role. They are cooperative with one another to form a team and are eager to learn the rules. There's something known as cooperative play, which is the characteristics of play exhibited by the school-age child with cooperation to others and the ability to play a part in order to contribute to a unified whole. In regards to personality and temperament, creative efforts and alternative methods of learning should be valued. Then on to sexuality, they begin to form an awareness of gender differences and sexuality becomes more pronounced. They will have an increased curiosity for changes about their body and the need for education to establish a healthy self-esteem. They may have an increased interest in sexual issues, and it's important to discuss appropriate and inappropriate touch. The nurse should encourage the child to go to more than one person, an important approach if the child is uncomfortable about a relationship with any individual, and it is often advisable to ask occasional questions about sexual issues to learn how much the child knows and to provide correct information when answers demonstrate confusion.
For communication or speech and language, the children should learn how to use language correctly, including correcting any lingering pronunciation or grammatical errors and learning the pragmatic uses of language. Their vocabulary increases. They become more technologically savvy with communication. They enjoy writing, so you need to encourage the kids to keep a journal of their experiences as a method of dealing with anxiety. Their use of language is mature, and a child is able to converse and discuss topics for increasing length of time. Health professionals can assess child's knowledge before teaching, teach techniques such as counting or visualization to manage difficult situations. and include both the parent and the child in healthcare decisions. For fine and gross motor skills, refinement of coordination, balance, and control. Motor development is primary, necessarily for competitive activity, and some gross motor skills are fostered by ball sports, skating, dance lessons, biking, etc. Most children at this age can ride a bicycle without training wheels, run very well, stand on one foot for a minute, hop forward on one foot, catch small and large balls from several feet away, jump rope, combine 2 or more motor movements, examples like running and kicking a ball at the same time. Fine motor skills are well developed through school activities such as writing, reading, playing a musical instrument, etc. And fine motor skills refer to the movement with the small muscles of the hands. Most children at this age can write legibly, copy words with ease, stay in the lines when coloring, tie a knot, and tie shoelaces. Some nursing implications, meaning allow time and energy for the school-age children to pursue hobbies and school activities, recognize and support child's achievements, reinforce the importance of playing games with friends to both parents and children, advise parents to provide a quiet setting for homework, and to reward the child for concentration, and to encourage the parents to see their children as individuals who may not all learn the same way. Communication strategies, some of those are to provide concrete examples or pictures of materials to accompany verbal descriptions, assess knowledge before planning the instruction, allow child to select rewards following procedures, teach techniques such as counting or visualizations to manage difficult situations, and include child in discussions with the parents. So educate using play, games, a toy, or praise. Some diet is making sure they have adequate calories, vitamin D, calcium, iron, vitamin A, and there's a concern for obesity in this age group, and some discharge planning for this child who might have a cast or a brace applied should address the activities in which the child can participate and which those the child must avoid. And those are our references.